Understanding neurodevelopmental disorders. The basics. Neurodevelopmental disorders affect brain growth and development, impacting learning, behavior, communication, and social skills. Early recognition and support can significantly improve outcomes. The brain's development starts before birth and continues into early adulthood. Disruptions can lead to neurodevelopmental disorders. Genetics and environmental factors play roles. Researchers work to understand these causes better. Individuals with these conditions have unique strengths. One well-known neurodevelopmental disorder is autism spectrum disorder, ASD. ASD affects communication and social interaction, with symptoms varying widely. Early diagnosis and tailored interventions like behavioral therapies are crucial. Another common condition is attention deficit/hyperactivity disorder, ADHD. ADHD involves patterns of inattention and/or hyperactivity impulsivity affecting functioning. Treatment often includes medication, behavioral therapy, and lifestyle adjustments. Intellectual disability ID involves significant limitations in intellectual functioning and adaptive behavior. Early intervention programs help children with ID develop crucial skills. Specific learning disorders like dyslexia and dyscalculia affect the ability to learn specific academic skills. Early identification and specialized teaching methods are key. These conditions highlight the diversity of learning styles. Understanding ADHD helps create supportive environments at home and school. Support needs vary based on individual abilities. The focus is on maximizing independence and quality of life. With the right support, students with learning disorders can achieve academic success. These disorders affect individuals despite having average or above average intelligence. Tailored interventions help manage challenges effectively. Early intervention prevents frustration and academic failure. Defining eating disorders. More than just food. Eating disorders are serious mental illnesses, not lifestyle choices. They involve severe disturbances in eating behaviors and related thoughts and emotions. People with eating disorders often become preoccupied with food, body weight, and shape. This preoccupation can lead to dangerous eating habits and significant health problems. Eating disorders can affect anyone, regardless of age, gender, race, or socioeconomic status. They are complex conditions requiring professional help. Biological, psychological, interpersonal, and social factors contribute to eating disorders. The media often portrays unrealistic body ideals, fueling body dissatisfaction. Eating disorders are often coping mechanisms for deeper emotional pain. Restricting food, binge eating, or purging can temporarily numb difficult emotions. These behaviors worsen emotional and physical health, creating a vicious cycle. Addressing underlying emotional issues is critical for recovery. Therapy helps develop healthier coping strategies. Stigma and misconceptions can prevent individuals from seeking help. Education about eating disorders creates a supportive environment. Early detection and intervention improve recovery chances. Friends and family should approach the topic with sensitivity and understanding. Eating disorders are treatable with professional help. Anorexia nervosa involves severe food restriction and fear of weight gain. Bulimia nervosa includes binge eating followed by compensatory behaviors. Binge eating disorder, BED, involves recurrent binge eating without compensatory behaviors. ARFID involves failure to meet nutritional needs unrelated to weight gain fears. Early intervention and tailored treatments are crucial. Section 5. The Intertwined Path. Neurodevelopment and Eating Disorders. Research shows a connection between neurodevelopmental disorders and eating disorders. Individuals with conditions like ASD or ADHD may be at higher risk for developing eating problems. Sensory sensitivities in ASD can lead to restrictive eating patterns. Impulsivity in ADHD might contribute to binge eating episodes. Understanding this link is vital for early detection and tailored interventions. Sensory processing issues are a key factor. Rigidity and a need for routine in ASD can manifest in strict food rules. Stimulant medications for ADHD can suppress appetite, leading to disordered eating patterns. Standard eating disorder treatments may need to be adapted for neurodevelopmental conditions. A multidisciplinary team approach is often best. This team might include a psychiatrist, psychologist, dietitian, and specialists in neurodevelopmental disorders. This collaborative approach ensures all aspects of the individual's health are addressed. Early intervention programs can help individuals develop crucial skills. Specialized education and therapy support their development. Section 6. Recognizing the signs, early clues, and overlapping symptoms. Recognizing early signs of an eating disorder, especially with a neurodevelopmental disorder, can be challenging. Look for changes in eating patterns or new anxieties around food. Significant weight loss or failure to meet growth milestones are red flags. Overlapping symptoms can complicate diagnosis. Social withdrawal, repetitive behaviors, and anxiety are common in both types of conditions. A thorough assessment by professionals familiar with both conditions is essential. Parents, caregivers, and educators should be aware of potential warning signs. Open communication and a non-judgmental approach are important. Early detection significantly improves treatment outcomes. Seek professional advice promptly if you notice concerning signs. Eating disorders are treatable illnesses. Treatment needs to be carefully tailored for co-occurring neurodevelopmental disorders. Recovery is possible with the right support and a comprehensive treatment plan. Early intervention programs can help individuals develop crucial skills. Section 7. Actionable steps. Seeking help and initial interventions. Acknowledge that a problem may exist. Approach with empathy and concern, avoiding accusatory language. Seek professional help promptly. Your primary care physician or pediatrician is a good starting point. They can provide referrals to specialists. Find professionals experienced with eating disorders and neurodevelopmental conditions. Gather information about eating disorders and treatment options. Reputable organizations offer valuable resources. Prepare for initial appointments with specific concerns and questions. Gather relevant medical history. Seeking help is a sign of strength, not weakness. It is the first step towards healing and recovery. Early intervention programs can help individuals develop crucial skills. Specialized education and therapy support their development. Section 8. Navigating treatment scientifically backed do's and don'ts. Seek evidence-based treatments like family-based treatment, FBT, and cognitive behavioral therapy, CBTE. Adapt therapies for individuals with ASD using structured sessions and visual aids. Don't focus solely on weight or food. Address underlying psychological factors. Treatment should consider how neurodevelopmental conditions impact eating behaviors. Involve a multidisciplinary team for comprehensive care. This team may include a medical doctor, dietitian, therapist, and specialists. Don't expect a quick fix or blame the individual. Recovery is a process with ups and downs. Relapses are opportunities to learn and strengthen coping strategies. Offer consistent support, understanding, and encouragement. A supportive environment is vital for healing. Early intervention programs can help individuals develop crucial skills. Specialized education and therapy support their development. With the right support, individuals can achieve their full potential. Reducing stigma is vital for community well-being. Eating disorders are treatable with professional help. Section 9. Building a supportive environment and looking towards recovery. Creating a supportive environment is fundamental for recovery. Family members and friends play a crucial role. Educate yourselves about both conditions. Avoid comments about food, weight, or appearance. Focus on the person's qualities and strengths unrelated to their looks or eating habits. Celebrate small victories and offer encouragement. Patience and understanding are paramount. Recovery is not a linear path. Professional guidance for families can be helpful. Full recovery from an eating disorder is possible. Individuals can learn to manage neurodevelopmental challenges and leverage their strengths. Treatment aims to improve overall quality of life. Understanding the complexities of these disorders is vital. Early recognition, seeking professional help, and building a strong support system are key. With the right interventions and ongoing support, individuals can overcome eating disorders. There is always hope for a brighter, healthier future.